I can't think of a better forum for sharing my perspectives on healthcare in Ontario than with you here today at the Economic Club of Canada. As president of the OMA, I've had the opportunity to work with people with whom or for whom I have really the most profound respect. I've spoken with so many informed, committed, and fascinating people from both within the healthcare sector and outside it. And it really has been an extremely rewarding year for me. It's clearer to me today than ever that being a doctor in Canada's largest province is an immense privilege. It's also a great responsibility. And I know that those of us who deliver care every day take that responsibility very seriously. Now, my guess is that many of you are here today to hear me talk about the relationship. The currently fractured relationship between Ontario's government and the province's doctors. And I will. How could I not? But I'm not interested in casting the Premier or the Minister of Health or the President of the Treasury Board as villains in this piece, because they are not. What they are, I believe, are people trying to solve a tough problem, but going about it the wrong way. As my colleagues at the Ontario Nurses Association said recently, healthcare cannot be ignored to reduce the deficit. And while I don't claim to be the one with all the answers, I can say with confidence that I speak for a group of people who know as much about healthcare as anyone, anywhere, and who care as much about healthcare as anyone, anywhere. So I want to start by making very sure that I place what I have to say in a context of something bigger than provider incomes or government bottom lines. Our publicly funded healthcare system is in the midst of a crisis. Not on the verge of a crisis. In crisis today. And let me say, I don't envy the many challenges that Premier Wynne and Minister Hoskins and Minister Matthews face as they try and deal with that crisis at the same time as they try and climb out of the serious economic hole that they are in. But while you can't ignore an $8.5 billion deficit, you also can't ignore the healthcare needs of this growing and aging province. You cannot turn a blind eye to people's medical needs. Every year, the population in Ontario grows by more than 140,000 people. That's a little bit like everyone in Prince Edward Island deciding to move to Ontario. Everyone, that is, except the doctors. How many of you here today have a family doctor? Consider yourselves lucky. There are still 900,000 people in Ontario who don't have a family doctor, and the chances of them finding one are becoming grimmer. Now, we're talking here about a province that prides itself on its healthcare system, partly defines itself, in fact, on its healthcare system. And close to 1 million people don't even have access to a primary care physician. And we as a society are getting older. And you cannot ignore the impact of that on our healthcare system. In 1971, seniors represented 8% of the population. Today, they represent 15%, and by 2030, 25% of our population will be senior citizens. And many seniors have complex chronic diseases. They need more care, not less. Now, I could go on listing problems. You all know them. The government knows them. But what we're missing here in Ontario is a long-term vision for the healthcare system. a long-term vision that truly meets the current needs and the future needs of our growing and aging population. And in the absence of such a vision, we find ourselves in the midst of a healthcare crisis. Specifically, a sustainability crisis. Now, the government's recent budget will give us healthier roads and transportation, but certainly not healthier people. The government acknowledged that with a stronger economy, it needed to invest in infrastructure. And that's exactly what it did. Meanwhile, it continued to choke the healthcare system. In fact, this budget plans for lower increases in healthcare spending over the next 3 years than at any time in modern history. And every day, new devices, treatments, and drugs are proven to be effective. And when they are, patients deserve them. According to the latest figures from the Canadian Institute for Health Information, per capita spending on health in Ontario ranks 9th out of 10 provinces, $3,700 per person in Ontario, as compared to $4,700 in Alberta, $4,400 in Manitoba. Now, on the surface, in the budget, you see a 1.9% increase in health, and that doesn't seem so bad until you look a little deeper. And you see that hospital budgets are flatlined again for the 4th year in a row, while demand and costs are increasing every year. Doctors are still being cut, while the need for our care and our costs are rising. We are not even resourcing the current needs, and every year that problem compounds. Yes, we have a sustainability problem. How many times have we heard that healthcare transformation is needed? Transformation is a warm, fuzzy panacea. It's like patient-centered care. Unfortunately, they're catchphrases, and too often they're used to mean, let's make care cheaper, not better. If we were to do it right, we really could improve healthcare and build a better system for the future. We have some of the best healthcare providers in the world right here in Ontario, but we're not doing it right. And that is the context in which I want to place my remarks about the breakdown in negotiations between the province's doctors and the government, and the subsequent imposition of massive cuts to medical services. The government is trying to steer through a storm, but they are so focused on trying to keep this tractor trailer on the road that they haven't even noticed that they're driving in the wrong direction. They're trying to grind their way up the hill, the sustainability crisis. But it's an icy hill, and we keep sliding back down. The government has an action plan for healthcare. The problem is that plan is driven by short-sighted responses to fiscal concerns instead of sustainable responses to real healthcare issues. Now, our government is not alone in this. In fact, the World Health Organization said, and I quote, "Health ministries often suffer from myopia. Because they are seriously short-sighted, ministries often lose sight of their most important target, the population at large." Take the government's recent unilateral decision to cancel funding for medical specialists to care for patients with things like diabetes, heart failure, kidney disease, patients with complex problems who need more time, more care. When I operate on someone and remove a pancreatic cancer, many of those patients become diabetic and need specialized care. It's critical that they can get the care they need once they leave the hospital. My 84-year-old father last year was hospitalized for heart failure. He only had to spend 1 day in the hospital, and he was able to go home and get the ongoing care and time that he needed from his cardiologist and his general internist. That care has helped prevent him from needing to be admitted to hospital again. But now that care is at risk. Now, governments will soon be creating legislation around medical aid in dying. Now, there's much more to this than a Supreme Court ruling, and this work cannot be done in a vacuum. Patients, providers, and government must work together to ensure that however the Supreme Court ruling is implemented, it is done in the context of a comprehensive and integrated end-of-life care plan. And that plan must include accessible, quality, palliative care for everyone. Without this, we risk an environment where patients who can't get access to high-quality palliative care are asking for assisted death as an alternative. Like you, as a husband, a father, a son, I want a system that is constantly improving the quality and the standard of care for patients. And I can tell you, as a doctor, I want that as well. I want the healthcare system to be responsive and sustainable, like so many other industries. There seems to be a concerted effort to replace doctors and nurses with other providers, driven by a need to cut costs. Now, it's an idea that, for the right reasons, has merit, but not when looked at through a purely fiscal lens at the expense of the most appropriate patient care. There are many examples of care that physicians provide or have provided in the past that can be delivered as well or even better by nurses or pharmacists or other health professionals. And to improve the system, to help make it sustainable, we should explore and capitalize on these. There's also a great deal of patient care which requires the specialized expertise of doctors. No one would dispute that. And in those areas, it's clear that we should not be looking for alternative providers just because it's cheaper. We cannot sacrifice the standard of care that patients deserve just to save money in the short term. Make no mistake about it. Ontario's doctors recognize that resources are limited. That's why in 2012, over 80% of doctors voted to accept a deal with the province that included a 4% cut on average to fees. That's why recently we've offered to freeze doctors' fees for 2 more years on top of that. We're willing to do our part, but we're not willing to put patient care at risk. We are not willing to dismantle the system advances that we have made together over the past decade. And we are not willing to stand by silently while the government balances their budget on the backs of doctors and patients. It's not rational. It's not sustainable. And it is bad for every single person living in this province. Between 2012 and 2016, the government will have taken almost $1.5 billion out of medical care, while at the same time, our population will have grown by over 500,000. With these cuts, with this approach, the government is eroding quality. It's making it much harder for Ontario's healthcare system to support the right care. And no matter how the government tries to explain it, the unrealistic and arbitrary hard cap on the physician services budget that they have imposed means that doctors are being told to see fewer patients or be penalized. And that means reduced access and longer wait times for patients who are already struggling to get the care that they need. Let me give you an example what is taking place right now because of these cuts. An example from a physician who's here with us today, Dr. Clement. Dr. Clement is a family doctor with a full practice. She also delivers babies at St. Joseph's Hospital here in Toronto. She's part of a family health organization of over 35 doctors on the west side of the city. Her husband, Mr. Riki, is the executive director. Now, she practices in an area that has been growing exponentially. And there's a constant stream of phone calls and people walking into the office in search of a family doctor. As a result, they've just brought on 3 new family doctors and had planned to bring on several more. And then, the government announced their drastic cuts to health care, and particularly to primary care. As a result, it's now very unlikely that these new doctors will be able to join their group. And that means several thousand patients who would have found a doctor will still be waiting for care. The road the government has put us on will erode the gains we've made in access and quality of care. And the sad irony is, doctors and other healthcare providers across the system are more ready than ever to work together for the right kind of change. A year ago, I became president of the OMA and committed to spend my term addressing the barriers to seamless and integrated care within our system. Barriers between organizations, between providers, between hospitals and doctors and the communities that we serve. I could spend the rest of my time this afternoon listing the various ways in which the different parts of our system don't interact with one another as they should. They're like pieces of a chain that was never linked. But we're working to change this. Last spring, the OMA and the OHA brought together hospital CEOs and senior administrators with physicians from across the province at the OMA's annual meeting. And that led us to form a partnership with over a dozen provincial associations, system leaders that will work together to enhance relationships between providers and stakeholders, both at the front line and at the system level. And I'm pleased that many of our partners are here today. Patients Canada is one of our partners, and it seems so obvious, but it's often overlooked, that any discussion about healthcare must include patients as a partner. We've come together with a shared vision. We have brought together hundreds of providers, doctors, nurses, pharmacists, hospital administrators, and many others from across Ontario to begin that conversation about breaking down barriers and building the healthcare system of the future. Imagine if the healthcare system actually functioned as a system instead of a group of independent silos. Imagine a system where each part is focused on making the entire system function better and more effectively, rather than focusing on efficiencies in its own small part of the world, where the whole is truly greater than the sum of its parts. To build that system, patients and the frontline providers of care from across all disciplines must take ownership of the change. Ontario's doctors are eager to be leaders in this revolution. We, like others, don't just want to be part of the healthcare system of the future. We want to help build it. We want a system that works for patients across this province. By the Ministry of Health's own estimates, the need for medical care will grow by about 3% each year. Now, the government has decided to fund only 1.25% of that growth. That divide of hundreds of millions of dollars between what is needed and what the government is willing to fund will compound year on year. That is bad for patients. I think we can all agree on that. The truth about our economy is things aren't as bleak as they were. The cost of oil is down. The dollar is down. And that means growth for the provincial economy and increased revenues for the province. In fact, the recent provincial budget forecasts a $5 to $6 billion growth in revenue each year for the next 3 years, more than double the growth in the previous 2 years. That in itself should be a reason or an argument for investing in healthcare. But there's also another. Healthcare helps stimulate the economy. Just look at the contributions that medical practices make to the economy. The vast majority of physicians operate small businesses to allow them to care for 320,000 patients every day across this province. They pay for the infrastructure, the staff, the office space, the equipment to provide that care. The average physician in Ontario incurs overhead expenses of about $150,000 a year. But those expense payments by doctors also create significant economic benefits. $5.5 billion in GDP for the Ontario economy, almost 100,000 full-time jobs in this province, and $1.4 billion in total taxation revenue. So trying to solve the healthcare sustainability crisis on the backs of doctors is a bad idea, whether you're looking at it through a healthcare or an economic lens. It will damage the economy by reducing doctors' ability to maintain or to grow their practices to meet the needs of their community. And it will damage the economy and the healthcare system by driving doctors out of the province. Doctors in whose education we have invested millions of dollars in taxpayer money. These cuts are threatening Ontario's ability to be a magnet for the best providers, the doctors, the nurses, and the other professionals that we need, that our patients need. And they're coming at a time when communities across Ontario are still continuing to pay physician recruiters, whose job it is to convince doctors to come to their communities. I worked on finding a recruiter in Hamilton, where I live, a number of years ago, because we needed more doctors in Hamilton. The city of Hamilton still pays her to do that work today. Why? Because we still need more doctors in Hamilton, just like we do in almost every community across Ontario. So these days, what is a recruiter supposed to say to a potential new doctors? In fact, we just recently saw an ad placed in the Ontario Medical Review that said, and I'm quoting, "Frustrated with clawbacks in Ontario, we are looking for full or part-time physicians to join our established group of 5 family physicians in British Columbia. We have a large office with plenty of parking and an excellent support staff. The office is well equipped and we are on an electronic medical record." Then there's the United States, where a recent study projected a shortfall of up to 90,000 physicians over the next 10 years. That is more than 3 times the total number of practicing physicians in Ontario today. This should be a wake-up call for the province. Healthcare is, or used to be anyway, one of the major reasons that companies wanted to relocate to this province. The government's own communication says that companies should come to Ontario because the average healthcare costs for employers are less than half of those in the United States. And a highly functioning and vibrant healthcare system where better care is being provided and people are healthier attracts jobs and investment. It helps build a stronger, more prosperous Ontario. It's why many municipalities continue to pay for physician recruiters and why they highlight access to health care in their communities as part of their strategies for attracting business. I want the government to take that to heart. But I also want them to know that it is not all on them. Doctors want to help. We know there are better ways of doing things, and we want to work with the government. And we know that patients want their doctors and their government to work together. In fact, they don't just want it, they expect it. They deserve it. It's bad for patient care that Ontario's doctors and government are on opposite sides of a divided highway. It's bad for patient care to have government making decisions on their own about the healthcare system. Healthcare costs will continue to rise. After all, our population is growing and people are living longer. That's a good thing. If we make the right decisions today, if we get on the right road together, in the long term, we will keep that rise in cost to a minimum. If we can break down the barriers, if we can turn our myriad of silos into a true system, patients will have a better experience, and we will see incredible efficiencies created. This healthcare system of the future will not be created overnight. It will require upfront investments to achieve the long-term vision of a sustainable, high-quality system that maintains and improves on the standards. We can only do this if patients and the frontline providers of care from across all disciplines are allowed to take ownership of the change. I talked earlier about silos. Government must stop making myopic decisions based solely on fiscal concerns within their silo. They, too, must be part of a true system. We've already begun this work from the ground up with our partners, and we will continue to do it. And I invite the government to join us, patients and providers, in building the healthcare system of the future. Thank you.